What would be on your checklist? Let me give you her question that she said to Spectre. What are you going to do to restore the country back to what our founders created according to the Constitution? What are the things in the government now, Congressman Culberson, that you would eliminate in order to do what Katie wants?
I have drafted legislation, Lawrence, which I will file when Congress reconvenes, which will make all federal grant programs optional, that the state legislatures would have to pass a law on a record vote and approve every single federal dollar with every string. Now, that's important.
Grant programs are nickels and dimes. Let's get to the entitlements. Let's get to the single biggest thing in the federal budget. What would you do about Social Security? I assume you would repeal it, because that is socialism, isn't it?
Lawrence, let me tell you, Katie's question... No, I'm answering your question.
No, the question is, would you repeal Social Security?
No, Lawrence, I'm answering your question because Katie is asking, what would we do in Congress to restore the Constitution?
Okay, grants,
her question is, there are $600 billion worth a year of grant program money going out the door every year, Lawrence. That's big money that the states accept. No, sir, let me tell you, $600 billion a year is real money. You're being argumentative, Lawrence.
Compared to Social Security.
No, Lawrence, let me tell you.
What you would do about Social Security. It is socialism. It was imported from Germany. It was Bismarck's invention.
Lawrence,
FDR took it on. It is pure socialism. You must want to repeal it, don't you?
The way the federal government has taken over...
You're not going to answer that.
No, sir, I'm answering your... If you want an answer, Lawrence, if you want to answer...
repeal Medicare, it's a single-payer socialized system.
No one in Congress has suggested repealing either Social Security or Medicare.
None of you want to go back to where the founding fathers were, do you? None of you do.
Of course I do. Lawrence, I'm a Jeffersonian Republican.
Did Jefferson anticipate Medicare, or is that a socialistic invention of the 20th century?
You know, I guess you don't want me to answer the question. I'm a Jeffersonian and a Texan, and I am answering your question.
How can you accept Medicare? Is Medicare socialism?
You know, I'm not sure you want me to answer the question, Lawrence.
Is Medicare socialism?
Of course, no one is suggesting that anyone... No one wants to either repeal...
Can you say yes or no?
Of course not. Medicare is a program that's been in place for many years.
Because it's old, it's not socialism? Because it was done in the 60s?
You know,
Tell
Lawrence,
me what is not
I think,
socialism
Lawrence, you
about Medicare.
illustrate... Lawrence, you know, for your listeners, you're illustrating why MSNBC's viewership is in the tank, because you don't allow your people you're interviewing to answer questions.
Healthcare
and you know, Lawrence, this is why Katie and everybody else is going to Facebook. Everyone's going to the internet, because why listen to MSNBC when you won't even let the people you're interviewing answer the question? I'm a very serious Jeffersonian.
I don't want you to spin your time away here. I want you to get serious, okay?
I am serious, Lawrence. You haven't. You're not serious.
Medicare is not socialism.
You're trying to change the subject, my friend.
Medicare is not socialism. Why don't we just delete the over 65 part of Medicare and make it available to everyone? What's your argument against that?
No one has ever suggested repealing Medicare or Social Security.
Why not? They're both socialistic programs.
Because we have to, if we're going to restore the country to the constitutional framework the founders gave us, Lawrence, you've got to start with the federal grant programs that are sent $600 billion a year, that are sent out the door every year to the states, and once the states accept that money, Lawrence, then the federal government has got its tentacles and its hooks in the states.
In 1935, you would have voted for Social Security, right?
Of course, in 1935 it was designed, Lawrence, it was designed as a safe...
hated it. Didn't anyone tell you that?
Lawrence, excuse me, wait a minute. Am I going to be able to give an answer here or not?
1965?
Do you wonder why nobody listens to MSNBC? May I answer the question?
They don't want to hear your endless spinning. Would you have voted for or against Medicare? Would you have voted for or against Medicare?
In 1935, Social Security was set up as a safety net, Lawrence, as a last resort. And therefore, of course, it was there for people who my father, who grew up in the Depression, told me, my dad told me, without those safety nets, John, people just died. And that's unacceptable.
And that was a safety net over the opposition of Republicans.
You're heroes, Lawrence. And Lawrence, you're heroes. I know that. There are safety nets.
FDR was wrong to enact Social Security?
I just told you, Lawrence, if I were here in 1935, the very limited scope of Social Security as it was designed as a safety net of last resort, of course I would have supported that.
How would you have voted in 1965
In 1965, I voted against, in fact, Lawrence, I wasn't here in 65, but I did vote against the Medicare prescription drug bill. I voted against both farm bills.
I voted against was the invention of Medicare in '65 by Lyndon Johnson,
you know, Lawrence,
a Democratic liberal
I'm
president.
not sure why you had me on today if you're going to do the whole show. I'm giving you a very serious answer to Katie's very serious question. What will we do?
Move on. If you answer whether you had voted, just give me a yes or no on whether you would have voted for Medicare, and then you can talk for the rest of the segment.
Okay, yes. In 1965, Medicare, if it was designed, and I don't know how it was originally set out in '65, but I can tell you Social Security was a last resort in 1935.
Did we get a yes on Medicare in there somewhere?
Because Medicare is a very successful but wasteful program that wastes a lot of money that we need to focus on.
You would have voted for it? Is that what
in
you're saying?
Medicare in 1965, Lawrence, yes, I probably would have voted for it.
Go ahead, spin away.
Thank you very much. We have a crisis of cost today, Lawrence, and the cost of health insurance. This government, this new Congress, the new president, has taken advantage of an economic crisis to, as the chief of staff of the president has said, to do as much as they can to not let a good crisis go to waste, and they're attempting to exercise full government control over the entire healthcare system, and that's what Katie and the rest of us are objecting to. We know there's a crisis in cost, Lawrence, and we on the fiscal conservative side simply want to focus on the crisis in cost, eliminating the waste.
Let's go to the crisis in cost.
Yeah, let's talk about that.
You know that Medicare is a completely government-run healthcare system,
right,
and yet you're saying you would have voted for it.
And we today need to focus on eliminating the fraud, waste, and abuse in Medicare, Lawrence. And that's why don't we focus on that? $1 in $3 spent for durable medical devices under Medicare and Medicaid are wasted or fraudulent. These scooters that you see advertised, a lot of that is unnecessary and pushed on people in ways that are fraudulent. There's a new scheme in Harris County to set up ambulance services to charge $500 to Medicare to drive people to the doctor. Focus first, Lawrence, on eliminating the waste, fraud, and abuse.
All right, we agree on that. We both want to get rid of the waste, fraud, and abuse, all of it in government wherever it exists. Let me just get this straight. You would have voted in 1965 for a single-payer, government-run, totally government-controlled healthcare system for people 65 and over. You said you would have voted for that.
I'm not completely familiar with the way Medicare was structured in '65,
really?
But I do know how Social Security was set up. I can tell you 1935, Lawrence.
Really?
I know Social Security was a safety net.
But not 65.
I'm more familiar with the way it was set up originally in '65 as a last resort.
But you're sure you would have voted for Medicare, even though you don't know what was in it in
Lawrence,
1965.
we are in 2009 at a time of record debt and deficit, and you won't even permit the people you interview who are, listen, I'm here in good faith and earnestness to offer and talk to you and your listeners about the fiscal conservatives in Congress who are working hard to lay out alternatives to control costs, to stop fraud, and to protect the patient-doctor relationship.
You lie to America about the evil of government health care because you people, not one,
Lawrence, you don't know who I am.
You liars about government health care is willing to repeal Medicare, to stand up and be consistent and say, I hate government-run health care, so I want to repeal Medicare. Instead, you go out and lie to Medicare recipients that you're on their side, and then you tell everyone else government-run health care is evil.
Lawrence, I suggest you don't know the first.
You guys perpetrate every day.
Lawrence, do you wonder why nobody watches MSNBC?
Time with that.
It's unbelievable. Lawrence, do you wonder why nobody watches MSNBC? You argue with me. You don't know who I am. You call me a liar on national television. Yeah, it's objectionable. It's offensive. I have never. You know what, Lawrence? You have never interviewed me, buddy. You don't know who I am, Lawrence.
And then you lie and pretend it's an evil for other people.
Lawrence, I can tell you that my constituents are very happy with me. I just had a town hall meeting last week. It was a great success. It was very uplifting and energizing because we're on the same page, Lawrence. We don't want the government or anybody else between me and my doctor. My constituents and I agree that we will have the greatest health care system in the world, and I'm going to fight to my last breath to protect MD Anderson, the Texas Medical Center, to protect my constituents' right to make decisions about their health care with their doctor without interference from this government or this Congress or this president, and we want to control cost, absolutely. We want to make health care affordable and available to small businesses, sole proprietors, individuals. But you do that, Lawrence, by using common sense, fiscally conservative approaches that are just, frankly, common sense, and you protect the patient-doctor relationship. And that's something that my constituents and I agree on, Lawrence. I have never, and you and I have never even talked before. It's stunning to me that you would, call me a liar on national television. Well, you don't even know who I am. You never talked to me before. And I'm glad you're finally giving me a chance to talk here, Lawrence, because town hall meetings in District 7 are uplifting and positive because I represent my district with honor and integrity.
We got to go. Go look up that 1965 Medicare statute. It might surprise you. It is a socialistic program. Thank you, Congressman Culberson.